Good evening. Welcome to the Always Shine Your Light Equine Energy Point Education Series. My name is Kay Aubrey Shemaine. I'm the owner and director of Grand Adventures Ranch, which is a holistic equine wellness center in Sonoyta, Arizona. We offer weekly webinars and training on using lights as acupuncture, which we call photopuncture, and also light therapy in general. And tonight we're just going to do a comparison of how light therapy and magnetic therapy are similar and how they're different. We like to say that when you have a photopuncture system, you're carrying a lot of different equine therapists with you, because photopuncture has the body respond like many other different modalities. The one we're going to talk about tonight, magnetic therapy, is considered to help the body by increasing circulation in the area covered by magnets. And here on the right, we see a horse with magnetic wraps over his tendons. We also sell light wraps like that. I was going to put a picture of the light wraps up, but you wouldn't have been able to see the difference from the outside. They just look like wraps held on by Velcro. So magnetic therapy helps the body, and light therapy does too, by relieving pain and accelerating healing, mostly through increased blood flow, which means increased oxygenation of the cells where the magnets are placed. Okay, the magnets stimulate circulation, increasing the flow of nutrients to the muscles and aiding in carrying away excessive fluids and toxins. It is thought to increase the circulation in an area because blood has iron in it, and when you put the magnets over a part of the body, it will attract that iron and naturally open up circulation and pull more blood with iron in it to the area. Okay? Light increases circulation in a slightly different way. When photons are applied to living tissue, the tissue releases nitric oxide. Nitric oxide is the most powerful vasodilator known, and it acts to increase the size of blood vessels, arteries, etc. And it has a few other things in that it decreases edema, increases nutritional flow, and it releases endorphins that help to lower pain levels. So slightly different methods of increasing the circulation, but both the light therapy and the magnets increase circulation to the area treated with the light, or with either modality. So going back and reiterating how blood flow helps, all healthy tissue requires oxygen to live, to replicate, to be able to any of the enzymatic processes that clean the cell, repair the cell, give energy to the cell, all require oxygen. Okay? When the area doesn't have enough oxygen, the cells and tissues start to die off. Okay? So when we can increase circulation, we bring more oxygen, which helps to relieve inflammation, helps to relax muscle cramps, it helps to relax the ligaments, it helps to reduce spasms. And also, of course, more blood brings other nutrients as well, not just oxygen, repair materials, helps to carry away damaged tissue, etc. Carries away the lactic acid and all the different acidic agents from when those cells break down, and anything that's causing additional necrosis to the area. So increasing circulation overall has lots of benefits, whether it comes from magnets, massage, essential oils, stimulants that help to stimulate the tissue, or light. So we all love getting better circulation. Why do we use this kind of therapy, either magnetic or light? Well, because it reduces inflammation. It helps to relieve pain in soft tissue injuries. It helps to relieve joint pain, more circulation to the joint, freeing things up. Helps to relax and relieve tight muscles, tendons, ligaments, which is why we see a lot of the magnetic blankets that are out there. It's used as a preventative treatment. If you can warm the tissues up, warm the joints up before you're going to exercise, they're less likely to tear. And it helps the body to eliminate scar tissue, splints, other small bone flakes, help to reabsorb things that it doesn't need anymore. So we use magnetic and light therapy for a lot of reasons. But what does light do that magnets don't? Okay, I'll agree. I love magnets. We've got magnets that we've used, and we still use them. But I almost always reach for my lights instead of magnets because I get even more. Okay, we get increased production of collagen and fibroblasts for repairing wounds. The light literally stimulates the body to release those repair materials. We get an uptake and release of ATP, which is what carries energy to all cells. So it actually is, like hooking up an ever-ready battery pack to the tissue, re-energizing it, helping it to repair itself, helping it to be able to carry energy to the rest of the body better. It stimulates increased RNA and DNA synthesis, so the body produces more tissue more quickly. And now it has the repair material to do it, and it knows to do it because of the RNA and DNA synthesis. It reduces the excitability of nervous tissue. So we know that light has been proven to give rapid pain relief because it lowers the excitability of the nerves. They just stop firing so much, they don't hurt so much. That tends to be mostly with pulsed light. And then increased phagocytosis. So light stimulates the body to break down and digest and carry away dying and diseased and dead tissue, meaning that it can repair wounds more quickly. So that's really our whole topic for tonight. I just wanted to go through and touch base a little bit more on how, we get all these different forms of therapy with our light therapy.